Hi everyone, this is Mrs. Adepeju Oyesanya, certified lactation educator, and I am Dr. Amanda Jones, your wellness educator.
Yes.
And we're here today to do a series of little interviews with Mrs. Oyesanya. Today we're going to talk about breastfeeding, not so much in the workplace, but breastfeeding in the context of women who have gone back to work. Now, Adepeju, a lot of women go back to work in this country when the baby's pretty little. Sometimes baby's 2 months old, 3 months old, 4 months old, you know, and both our Ministry of Health and the World Health Organization is recommending that we breastfeed this baby 100% for the first 6 months. Could you tell us, many women feel that the reason they have to put the baby on the bottle from very early is because they need the baby to be able to exist without them when they go to the workplace. So how can you help them resolve this dilemma? What can you do? What can you recommend?
My first recommendation is to educate yourself.
Educate yourself.
Is power.
So this is the mother educating
The mother
herself.
needs to educate herself. I would also ask that the father educate himself also. So
But
he can
when?
provide.
Is this after they start nursing the baby and in the first few months when?
No, even during pregnancy, start thinking of your long-term plans. You know that if your maternity leave will most likely be 12 weeks, which is 3 months, that you'll be returning back to work. What are your plans? So you start having a conversation with your employer before you leave. You ask them, do we have a lactation policy here at work? I'm most likely interested in possibly breastfeeding my child when I return back to work. Is there a space for me to express milk when I return back to work? Is there a place for me to store the milk, whether in the refrigerator, the personal cooler, those types of conversations?
So while you're at work, before you go on maternity
Yes.
leave, you start talking to your employer,
Yes.
your manager,
Yes.
about
Your HR representative.
yeah, putting things in place for you,
Yes.
so that you can express
Yes.
milk while at work.
Yes.
Okay.
So that when you go home, you know that, yes, I'm here for 12 weeks, but the long-term goal is to continue to breastfeed, so we meet the 6 months recommended by the World Health Organization and also our health ministry to achieve that. So what in essence what you're doing is you're creating a pool of support for yourself and the baby. You yourself are educated, your partner's educated, your workplace is educated. Now how we can come in to assist you is we provide classes for mothers who are expectant and mothers who are returning back to work. We also then provide classes, policy assistance for workplaces.
So you're providing classes to encourage and teach and inspire and guide the parents who are expecting.
Yes.
And you're also providing advice and counseling and guidance for the workplace.
Yes.
So have we found that now we have workplaces, offices in Trinidad and Tobago, which are fully supportive of the mother returning to work and expressing milk and storing it in the staff fridge for the baby? Are we getting to that place?
We're getting to that place slowly, but we have some places have different components. Some places see it as just we offer space.
We offer space.
And that's it, but no proper education, there's no written policy.
So, so in other words, if you change the manager next year, all of a sudden you can have a challenge.
Yes.
The manager may say, well, this isn't proper, or why do you have to do this?
Exactly. And
Okay.
so to prevent that, our focus at that start is it is education first, it's policy, and then it's space. So that in that way you cover all aspects. In
Education.
Yes, in educating both the parent and the HR representative and the general workplace.
Yeah.
It is then policy because it's written. Whether the HR manager is there, whether your boss is there, whether I'm there,
It's agreed.
it'll exist without us. And then we talk about space. It's really, space minimally is really the last issue. Because really, an organization can use their lunchroom if no one's using it. Can use a conference. We can always think of creative ways regarding space.
Or you can simply maybe block off an
Partition.
area if
Yes.
the mother wants to express at her desk.
Yes, you
Yeah.
know, but we can find creative ways to facilitate lactation at work. But more importantly is to make sure that everyone's educated about it, give proper support, and then a policy exists. I just say, we have policies regarding like how payroll goes. We have policies regarding if you're sick, you need to bring a doctor's note. I think in the same way we need to treat this issue so that there's set rules of engagement.
A policy issue. Now, where have you found the resistance in this process in Trinidad and Tobago? Are you finding the resistance from the mothers? Is it that they don't like the idea of having to express milk at the workplace? Are you getting the resistance among the colleagues who think that, you know, breast milk don't belong in the workplace? Or is it the employers? I mean,
I think I would prefer not to use the word resistance. I would I would rather use the word lack of education and lack of information. I think, I mean, I had a meeting with a company, I won't say their name, and they were like, we didn't know all this.
Okay, so they weren't aware that this was worth doing.
And they provided space, but they didn't know the inclusiveness of it all. They thought just once they gave space, that was sufficient.
Enough. Okay.
And I'm like, no, they're like, we didn't know. So I think really...
So what else do they need to do? You mentioned, I think storage, is it space and storage?
It's space, storage, policy, education.
What about time? What about recognizing that the mother's deadlines can't be so tight so that she's stressed out and therefore can't get her milk to flow when she's ready to express?
Back to policy.
So
those are things that we would deal with in policy about flex time, job sharing, you know, how breaks are done. That's all the policy.
So you're encouraging companies to have a written policy to support their moms?
You must have a written policy so that the things you mentioned just now, what about, you know, time off? What about job allocations? What about this, and this? If we have a written policy, we know how we're going to engage ourselves.
And the importance of educating not just the moms to be, not just the young woman of childbearing age, the importance of educating everyone so that they will support their colleague when she comes back to work and needs to nurse, and they'll not be like, we have work to do, what you're doing, why don't you give the baby a bottle?
Exactly. And then again, because we work as a team, you know, in our respective workplaces, we need everyone on board, both males, both females, to understand, because we're at different life cycles. There may be moms at work who are expectant. There may be fathers who are expectant. Their wives may not work there. They may work elsewhere. The thing is, they too, if a child is sick, will have to call in sick. They may not be able to come to work. That's going to affect everybody else at that job site.
So you mentioned the child being sick. So when you, and of course we know with breastfeeding that infants who are completely breastfed for the first 6 months and supplemented with breast milk for the subsequent 6 months, they don't need hospitalization. They usually don't need antibiotics or doctor's visits. Usually the most they get is a little virus which they're able to cope with. I mean, I've seen this from talking to numerous mothers who have breastfed versus those who have supplemented or used formula. So is that something that you also emphasize when you do your workplace workshops, just showing the employers and the staff that if baby is better and baby's healthier, then the mother can put out more in the workplace? And
mother and father.
Mother and father.
It always has to be mother and father. There's a unit raising the child, so we also need to discuss it and understand that.
So both parents can be more present.
More present at work, right? So in actuality, what you're actually doing for yourself as a company is you're increasing your productivity.
Right.
You're also increasing happier employees.
And I think when employees are happier and they feel that their company, their boss, cares about them, they have a greater sense of loyalty and affection for the company.
For work.
Work satisfaction.
All those things. And again, we need to look at things very holistic. It's not that you just come to work and you're this one person at desk A. That's all you do. You have a life outside. What happens to your coworker directly affects you. We're all interconnected. It's like a big spider web. You know, and the web is going, and the web is spinning, and there's different angles to the web. The web together makes this web. Together in our workplaces, we coexist.
Yes.
Right? So coexisting together, that's why I emphasize that both males and females are included in our workshops, both that I do for workplaces and I do for my clients privately, because they're both integral. We both need them for the benefit and the well-being of the child. And both of those people are most likely both working.
So you generally request, if you're going to do a workshop in the workplace, that you have men and women, because this is not a woman's issue.
It's not a woman's issue.
It's a social issue.
It's a social issue, and it's a health issue. It's a workplace issue. And in addition to that, with mothers, more specifically being the largest growing segment of the workplace, how are we going to treat them? You know, mothers who are working, how are we going to treat them in the work environment?
So you're saying we don't need to compromise on breastfeeding just because women are in the workplace and need to get back. Are you an advocate though for a more prolonged maternity leave if a nation can afford it?
Yes,
I feel that would be useful.
There are other nations, Canada, some European countries who have longer maternity
And how long
leaves.
is this?
Some can go up to 16 weeks.
16 weeks.
Yes.
Okay.
You know, and some even facilitate for a year.
Yes.
So I think that what we need to look at is what works best in our situation. Even if you cannot facilitate longer time off, you can provide flex time. You can provide different job descriptions that are a little more flexible than they were before for this person for their first year.
Yes.
We know that for the most critical time period, relating to breastfeeding for the first year of life.
Right.
I mean, the U.S. has initiated that employers who have more than 50 employees must provide lactation for the first year at least minimum. They must support it, provide
support breastfeeding
for their employee who is lactating. So I think that is an initiative that is written in stone that we all know the rules for engagement.
That's fantastic. I hope it's going to go a longer way to increasing breastfeeding rates in the U.S.
Yes, and and not only our employers, at the federal level, there's policy being implemented at hospitals. We're realizing that it's not just work, it's hospital. All these people are partners in the health care of our nation. And in the same way, we're seeing it here too, that the hospitals here in Trinidad and Tobago, the practitioners, OBGYNs, pediatricians, all of us are players together in the well-being of our nation state. So it's in our benefit, and also employers, it's in our benefit to have the healthiest possible population. How do we do that? We know from the research, we know from evidence that lactation helps to facilitate that. And also, I mean, non-communicable diseases. I mean, people are saying, why are you talking about that? The child was just born yesterday.
Yeah, why are you talking about diabetes, high blood pressure, heart attack, stroke, cancer?
Because that child was just born in the first hour of life. You can put them on a trajectory towards good health.
Yes, and breastfeeding is the way that we get that started.
It's the way we get it started. So we can optimize life from the onset. So it's not so much optimizing life when you're in your 30s, your 40s, your 50s. I think we need to reshape our thinking. We think health begins when you're 50 or 60. Now I should walk. Now I should swim.
Yeah.
But you should have been walking, swimming, riding the bike, eating your vegetables.
Because the reason you get lifestyle diseases in your 40s and 50s, and now even in your 30s and 20s, is because of cumulative years of abuse. Well, you know, there's so much we could say about breastfeeding. It's such a broad topic. But when it comes to breastfeeding in the workplace, I know some mothers start to store milk up in the previous months before going back out to work. How do you feel about that practice?
We recommend that. In our Breastfeeding 101 class, we will have a discussion. We teach techniques that mothers can utilize. Yes, like everything else. That's why I said the first thing in this whole conversation is education. Because once you're educated, you're better able to make a better decision for yourself.
That's right.
So we educate mothers that when you know you're going back out to work, you start storing. 3 to 4 weeks, you start practicing how to store milk correctly, what your production levels are, you know, so that you are not so anxious when you actually now have to perform it in your workplace. And then you then start
that's right. So you're confident. It's not like, oh my God, can I do this?
Yes.
It's like you've worked through the problems. Do you think in the first 3 months a lot of women actually need, well, women do need breastfeeding support.
Yes.
And you know, there are many women who make it through without an external professional coming in. They might have help from mommy or neighbor or auntie or sister. What sort of problems can the breastfeeding consultant or lactation educator such as yourself do to help the mother with? I'm saying a little bit wrong. Yes. What sort of issues can the lactation consultant or certified breastfeeding educator help the mother with?
Our job really is to help resolve any problems that may arise, which also sometimes just includes self-confidence.
Self-confidence.
You know, you may be lactating correctly without any assistance from us, but you just need that confidence. So when someone says, I think baby's crying a little too much, they're not getting enough, you can say with confidence, based upon the information I have, based upon our growth charts and everything, we're meeting the needs, you know, that everything's going on. Again, that's number one. I cannot stress education, because then you know what to expect. You know what's normal, what's not normal.
And that's a big issue.
Yes. So that
not knowing what to expect, because the people in your environment don't have
the proper information to
Yeah,
guide
because
you.
they don't have the experience in many cases.
Exactly.
That's one of the things that we have with this generation, with our generation.
Yeah, especially with absent parents, and
Yeah.
also maybe your mom didn't breastfeed, so how's she going to support you?
That's
along the
right.
way?
She doesn't know.
She doesn't know.
Yeah.
And in addition to that, lactation is not static. You know, the field changes all the time. So professionals maintaining the information. I go back to the States every year and I continue my education. So I'm at par with
Okay, so there's
my
more and more
practitioners
knowledge to impart.
all the time.
Yeah.
And just like there's journals from the American Academy, we have journals too.
Lactation
Breast journals
yeah.
and everything that we're reading, we're keeping abreast of what's going on and the changing
Yeah.
conversations in the field.
I want to close on one particular point because, of course, we can go on forever and ever on this topic. Every time I see women running these marathons for breast cancer, and all this is very good. In fact, I endorse it because exercise, vigorous exercise, definitely reduces your risk of cancer in general. It's wonderful. I always feel that the whole issue of breastfeeding is missing from the equation when we talk about breast cancer prevention, because breastfeeding has been demonstrated to be one of the natural normal activities for which the breast was made, which, you know, when put to good use, reduces your risk. And it's proportional. If you breastfeed 5 babies for 2 years each, of course not many women may be going through 5 babies 2 years each nowadays, but the longer you breastfeed altogether, the more your risk is reduced. So if women knew this, because women are very conscious and worried about breast cancer, that is something that is in the fabric of the mind in the society. If we knew this, wouldn't more of us make a greater effort to breastfeed longer?
Well, we took that upon ourselves last year.
Last year?
Yeah, October of 2011, we ran a campaign locally.
We
here.
being Best Start.
Best Start.
Yes.
Best Start ran a
Yeah.
campaign, and we educated people that breastfeeding helps to reduce cancer rates. And
Right.
you're right, the duration of time really matters. And it's funny enough, what we naturally should do is really what we should do.
I see. What nature seems to have intended
Yes.
has been demonstrated to be what's best for us. Yes,
long-term.
Best Start. Yeah.
Yes, Best Start. You get the best start in many
Yeah.
ways. You're helping the baby fight obesity, you're helping fight diabetes, you're helping fight these lifestyle diseases.
Right, so the baby his
Simultaneously-
or herself has a reduced risk of these
Yes,
conditions.
but then simultaneously you're reducing cancer for yourself.
Yeah.
Ovarian cancer, breast cancer,
Ovarian,
osteoporosis.
breast,
Yes, all
osteoporosis.
those.
Yeah. And that
are
was
being
something that
reduced.
took me a while
to link together.
to connect. The fact
Yeah,
that you can
we're
reduce your
using-
risk of osteoporosis,
Yes.
then it's because we've been brainwashed into thinking that our osteoporosis is proportional to our calcium intake. And you think, well, if I'm lactating, breastfeeding, then all the calcium is going into the milk. But it's really ironic. So, you know,
Education.
we're going to have to close because we can talk all day on this subject. I just want to say thank you
Thank
to
you very much.
Mrs. Adepeju Oyesanya from Best Start, and I look forward to hearing the feedback as the years go by regarding the changes in the workplace and our breastfeeding rates in Trinidad and Tobago. Thank you so much.
Thank you,
Adepeju.
Dr. Jones.